Hello and welcome to It's Your Health. My name is Kimberley Haas. Thank you so much for watching today's program. Today we're going to focus on the flu. Of course, as many of you are aware, it is flu season again. It's time to get those flu shots. So Joe Raulinaitis from the Food and Drug Administration and I decided to do a show about this. He's joining me as the guest. We also have some very distinguished guests from Parkland Medical Center here in Derry. I'd like to introduce all of you at home to them. I'll start with Ed Yorty. He's the Chief Medical Officer and Infectious Disease Doctor at the hospital. We also have Peter Sabini.
Actually, Sabini.
Sabini.
Very close.
Okay. He's the Internal Medicine and Infectious Disease Doctor. And Karen Kennett. She's the Director of Infection Prevention at Parkland Medical Center. Thank you so much for joining us today, folks.
Thank you.
I really appreciate it. I'm going to start today by having each of you introduce yourselves. We'll start with you first, Joe, for everybody at home who hasn't gotten a chance to watch our series just yet.
I'm Joe Raulinaitis. I'm a Public Affairs Officer with the Food and Drug Administration, and basically that brings me into an outreach capacity with distinguished professionals such as yourself and the good doctors and the nurse here. I talk about what the agency is dealing with, the issues that we're doing, explain them if they need to be explained, trying to bring knowledge about regulatory government out into the community. And being up here on Channel 17 in Derry has been a blessing for me. It makes my job a lot easier. It makes me really accountable. I get a message across, and you know, in the government we count noses and beans, and everything we do up here is looked at in a really favorable light to the folks and the bureaucrats down at our headquarters. So that's what I do. I get the message out.
Yeah, and we're hoping that soon we'll be able to share all of these shows with the greater community and the community online through our YouTube channel that we're just starting to develop. So everybody at home, make sure you watch that when the shows are available. Ed, I'll have you go next.
My name is Immunity, and I've been chairman of the Infection Control Committee for, I don't know, 10 years or something at the hospital, and most recently involved in the changes in flu policy at the hospital to try to encourage more influenza vaccinations. So it's a hot topic.
Oh, yes, of course. People have a lot of questions.
Yep.
Peter, we'll have you go next.
Sure. I'm, as you know, Peter Sabini. I'm actually relatively new to this area. I'm an infectious disease physician as well as an internal medicine physician at Parkland Medical Center, and as well as we working at Portsmouth Regional Hospital. Actually come here from as a former medical corps officer from the Navy, where you know, we worked a lot with infectious diseases, both outpatient and inpatient, and actually spent a number of years doing research on various aspects of public health, including some vaccine clinical studies. So, but I'm glad to be part of the community here, and we'll be working closely with Ed Yorty and Karen, who will introduce herself shortly.
Very interesting. Karen, I'll have you go ahead and introduce yourself to the audience.
Hi, I'm Karen Kennett. I am the Director of Infection Prevention at Parkland Medical Center. My background is combined public health, infection prevention, and epidemiology over the past 20 years of my career. I recently came on board at Parkland about a year ago, and I'm delighted to be with you today.
Oh, well, we're so glad to have you, Karen, and we're so glad to have each of our guests. There's a lot of people here that we can learn quite a bit from. So we'll start by talking about what is the flu, so people at home understand what the flu is.
Oh. That's a big topic.
Yes.
They'll keep us busy
Well,
for
is
a while.
it a virus?
Right. So influenza is an illness, principally respiratory illness, that's caused by a virus. First off, it's important to distinguish between influenza A and what people commonly refer to as the flu, because almost any viral illness, whether it's a respiratory illness or gastrointestinal illness, people will say they had the flu or had the stomach flu. That's totally separate and different entity from true influenza. True influenza is caused by either the influenza A or influenza B virus, and it is a very debilitating illness. I'm fond of relating to my patients what it's like because I've had true influenza twice. First, when I was in 8th grade, I had the Hong Kong flu back a long time ago. And then in my mid-30s when I was an infectious disease trainee. And what was unique about that second infection was that when I got ill and I started to hurt all over, I suddenly remembered what it was like in 8th grade. Now, you all know, as an 8th grader, you don't remember what happened the week before, but that was imprinted. I felt so awful. True influenza is fever 103 to 105. It starts off, you just feel feverish, you hurt all over you feel like a truck has run over you. And then about the second day, you develop the cough because the virus invades the lining of your trachea. And I distinctly remember that cough as being like razor blades in my chest. I describe it, I was out of work for a week, and as most of you know, doctors don't ever stop working even when they should. But I absolutely couldn't work. And so that's the illness that the vaccine is targeted at. So in a nutshell, that's influenza.
Okay, and so what are some of the other things that cause like the gastrointestinal sorts of dilemmas?
There are a wide variety of viruses. In the wintertime, there are enteroviruses principally that circulate. There's Coxsackie and Echo and viruses with a whole lot of different names. We're not very sophisticated except on a research level at identifying those. But many of the, most of the cases of gastrointestinal illness or, sniffles, cough, even the pneumonias that take you to bed, the majority of those are caused by unidentified viruses that are not influenza. So one of the other points to make is that the influenza vaccine protects against influenza infections, but there are lots of illnesses called flu-like illness, which are caused by other viruses. And that's one source of confusion and misconception about wintertime illnesses.
Right. Now, how is the flu spread? Where does it start? Does it travel throughout the world, through the northern and southern hemisphere?
Flu is typically spread through a droplet method. So you could be on an airplane with someone who may be infected with the flu, and you breathe in those droplets if you're close enough to do so. So it's very easily transmitted in the community. It also lives on the hands of people who are infected, who, of course, are touching things all day long. So I'd just like to take a moment to talk about hand hygiene, because hand hygiene really is the foundation of good infection prevention practice. So it's very important that we practice hand hygiene whenever possible. So things like when you're coughing, you want to make sure that you cough into your sleeve versus into your hands. When you're touching things, that you're either washing your hands with soap and water or using a hand hygiene product.
Right, and how about in our office place as well? I mean, that's another source of, places where we could find things that we don't necessarily want in our bodies.
Hand hygiene really is the single most important thing that we can do to prevent the spread of infection. So keep a little hand hygiene, alcohol-based hand rub on your desk and use it periodically. It goes a long way.
How about touching your own face? That's another thing that I know.
Yes, if you're touching, most of us are inoculated, by touching our eyes, our nose, our mouth. So, and most of that is unconscious behavior. So again, if we're using the hand hygiene, you're reducing the risk of transmitting and inoculating yourself.
I'd like to elaborate on that part a little bit, because there was the business about touching your eyes, touching your face. As an ID doctor, I've trained myself not to do that. But there was a study done on rounds. Do you know about this one, Peter?
With pagers or mobile phones?
No, watching medical students and residents as they stood around the bedside with their attending doctor in a teaching hospital as they went from bed to bed. And they counted, the individual touched their eyes, face, or nose something like 40 times an hour. And this is in a hospital setting where you would think you ought to be most conscious about your hygiene.
Do you think they were just nervous?
No.
I would be.
Keep your hands folded. You know, I think it's important. First of all, the personal protective measures are important. I think the other important aspect in terms of on the community level and public spaces is social distancing. It certainly has played an important role with pandemics and prevention. I think the 2009 pandemic flu, you taught us a lot with that, and there's still a lot of lessons to learn, whether it's physicians or healthcare providers showing up to work with a flu-like illness. They can very easily transmit that to other patients, despite our best attempts of hand hygiene and things. It's almost impossible to really be 100% with these types of things that we do in our everyday life. So I think social distancing, plays a real important role, and both any healthcare provider, teachers, people who work within public spaces need to know if they do have a flu-like illness, they need to see their doctor, but they also need to stay at home. That certainly plays a role in preventing the spread. But really, the number one way to prevent it is obviously through vaccination.
Yeah. Do you want to elaborate a little bit on that, Joe, for us?
It is intriguing to listen to these folks talk, because I get a clinical perspective that in the bureaucracy, it just doesn't come our way that easily. Dr. Yurt, I don't want to wax nostalgic, but I remember the Hong Kong flu.
Yeah.
I remember that. And that was tough. That was tough. We have mortality studies, morbidity and mortality studies that I throw out periodically, and it seems a little bit cold. Maybe you can clarify or verify a few things for me. Does the number of fatalities on the average from, I guess, 3,000 to 49,000 a year, does that sound accurate to you, gentlemen and ladies? Does that sound about right?
I think that probably is right. I think what Ed mentioned earlier is important to mention, and that is that influenza is a specific type of virus that requires a specific type of testing. And from clinical practicality, a lot of facilities, hospitals don't always test for influenza. And often what we see related to a lot of morbidity and mortality are complications from what could be a viral illness. So for example, pneumonia is really one of the number one killers in terms of infectious diseases, really worldwide. And we know that the bacterial pneumonias, which are really probably the lead cause of death related to pneumonia, a lot of them are actually what we consider secondary infections that could have been due to a prior influenza infection. In other words, the virus sets up shop, causes you to be immune compromised, your immune system breaks down, and then you get hit with a bacterial pneumonia. And then if you're not aware of these things, these testing isn't really done from a practical standpoint on a routine basis, that person ends up being sort of tied to the bacterial pneumonia and not necessarily a preceding influenza-like illness. So I think it's to be an underestimate, but it certainly is a big problem in terms of morbidity and mortality.
Sure.
I just wanted to state that I tried in the past to find an analog, something to help people judge the importance of influenza mortality, and I don't remember the exact numbers now, but I remember that that there were approximately the same number of deaths from influenza as from breast cancer every year.
Okay, and do you see the numbers going down? I mean, I talked to Karen early before the show, and we talked about this clinical fear or this awareness or negative awareness about getting the flu season a vaccine. I mean, that must be something that you all have to deal with. I mean, are we getting better about outreach? Are people getting more acceptable towards vaccinations?
Well, there's certainly, I can say that I personally, over the last 5 years, have really ramped up my endorsement of influenza vaccination. I think all of us, at least in the community-based ID, have become more and more aware of the importance of it.
Right, and if I can just add, if you were to sort of, correlate the influenza vaccine to all the other standard vaccines that we get as children or as adults, you notice a pattern, and it could be related to misconceptions about the safety of vaccinations in general. I think a good example of this is sort of what we've seen with, measles in 2011 in the United States, or pertussis, which has actually made a big resurgence this past couple of years. I think
it's whooping cough.
Yeah, pertussis is whooping cough, which is sort of the more common name. But I think in the United States over this past year, we've seen over 20,000 cases, several dozen deaths, and really that is a vaccine preventable illness. And so I think there's a little bit of complacency in folks getting vaccinations for any reason, and I think that goes along with, the routine childhood vaccinations as well as with, influenza vaccination. And I think it's easier to tell with these other diseases because, the clinical presentation for whooping cough is classic, and when physicians consider it, they typically test. So we are able to capture it with these other type of illnesses.
I thought pertussis had really faded out. I mean, I remember my parents talking about whooping cough from the 30s and early 40s, but it's interesting to know that it's...
Well, there is a resurgence now, and at least some of it seems to be tied to, there's this concept of herd immunity. That is, if you can reduce, if you can vaccinate everybody so that there's hardly any virus in the community, then even people who are not vaccinated or people whose immunity has faded over time remain protected because nobody in the herd, so to speak, is infected. But if you have pockets where there is not adequate vaccination, then it's very easy for infection to take hold again and then to spread to people who were perhaps previously vaccinated, but if the vaccine wasn't as effective as previously, then they too are susceptible. Actually, we're revaccinating adults for whooping cough now as part of the, since 2007, your tetanus shot has also had a whooping cough component to it.
Yeah.
Karen, what's your take on misconceptions about vaccination as it relates to the flu? What do you hear from patients?
We hear things like, oh, I'm afraid I'm going to get sick from the flu vaccine, and we understand that influenza vaccine that we give that is either intradermal or intramuscular is killed vaccine, and killed vaccine cannot cause illness. Right. Sometimes people just don't feel well as their immune system is kicking in and producing antibody, and there are variations on how people feel when this happens, and sometimes they interpret that as, oh, the flu vaccine got me sick. There are other folks who are frightened based upon side effects that have been reported, potential adverse reactions or allergic reactions to the vaccine.
Who's most at risk for contracting the flu?
I'd like to elaborate a little bit first on the misperceptions about the flu vaccine causing illness. First, the flu vaccine, it's not just killed virus, it's fragments of virus. And second, when I ask folks, what the infection was that they got after their flu vaccine, it seems like any respiratory infection they got within 3 months of the vaccine gets blamed on the vaccine. Right. And that's, our primitive intuition says, okay, here are two unusual events, they must be connected. Right. But that's actually not scientifically valid.
That's correct.
That's exactly, another anecdote to this is, just like when people sort of get what they think is food poisoning, they always blame it on the last meal they had. And in reality, you don't know what it was over the past, 5 to 10 days unless you have more than one case. And I think that's very true with that misconception.
And the other piece of that also is it does take approximately 2 weeks to build up antibodies sufficient enough to protect you from influenza. So if you've had an exposure prior to that, it indeed could be influenza, but not related to vaccine.
I mean, I think it's important to mention that, the vaccine that is made up every year that has to be done with at least 9 months of leadway really is thought up by a panel of experts that really look at the worldwide incidence of flu and which type of flu is circulating to try to predict what is going to be the major type of flu that they want to protect against. And that's why, your typical flu vaccine is made up of actually 3 parts of 3 different flu viruses that are thought to be predicted to be, the major causes of flu that coming season. But, with any vaccine, and with influenza in particular, there is a little bit of guesswork, if you will, but it's based upon what is sort of state-of-the-art epidemiology data. But even in sort of the best circumstances, the protection probably is at highest around 80%, which is very, very good for a vaccine. Of course, if you have new strains of virus like what we saw in 2009, the seasonal flu at that time was not very effective. People still got influenza, but I think the other important thing to mention is that not only do vaccines prevent illness, but it also mitigates the illness. So, some folks that say, well, there are some people that may have indeed gotten the flu after a vaccine if it wasn't sort of predicted to be the right strain. But in many cases, the vaccine, if it doesn't prevent it, actually mitigates it. So it makes the illness less severe is sort of a simpler way to put it.
Maybe we should just back up a little bit and
Yeah.
talk about the science of why we need to get the vaccine every year. The influenza is an unusual virus in that it changes its spots very frequently. So it undergoes constant mutation and reassortment, and so the predominant strain of flu every year may be different from the one you had the previous year.
Right.
So it's not just a case of getting a booster, it's a case of getting a vaccine that's matched to the virus that's anticipated to be circulating. So that's where the guesswork is. Typically the virus, it seems that the viruses that begin in the Far East then spread to the United States. So typically your viruses will have Middle Eastern or Far Eastern labels on them because that's where the strain was derived from. And their track record is pretty good. About sometimes there's a 50% match. Some seasons there's a 90% match between the vaccine strain and what actually circulates. I think one of the reasons that the flu vaccine gets treated differently from a lot of other vaccines is just that. Because it has to be given every year, people see it as more intrusive.
Can I add a question to that? And this is something that CDC and other public health agencies have talked about. A universal flu vaccination.
Yeah.
Is that credible? Is that wishful thinking?
They're working on it.
Okay, would it make everybody's job a little bit easier, I
Right,
suppose?
right, yeah.
Okay, so that's credible.
Yes,
Yeah, okay.
there's work. They've isolated some of the common using molecular technology and looking at the genome now. They've actually been able to isolate certain antigens that seem to be common between all the flu strains that don't vary from season to season. They're now working on whether an antibody against those antigens will be protective or not.
Now, are you folks guessing people? Are you betting people? 2 years, 3 years? I mean, I've heard various.
5 years.
5 years, okay. But don't hold your
My
breath.
guess. Yeah,
Right, exactly.
I'm not going to bet my house on it.
Okay, don't do that. Yeah, because I wondered about that, Kim. I really wanted to get that out and get a clarification on that, because where I sit, it's there are lots of fragments of information and stats floating around, and it'd be nice if we had a universal vaccine. That's for sure.
Now, what's the Food and Drug Administration's perspective on some of these issues, particularly relating to vaccination?
Basically, from a clinical standpoint, much of what we feel has been supported by the folks here. 6 months and up probably should get vaccinated. I do believe much of the mortality is in the 65-year age group and above. I think 90%. We're big for stats and facts and numbers, as I mentioned. So almost everybody should get the vaccine. I mean, of course, I'm sure Peter and Ed and Karen can clarify the folks that you don't want to be vaccinated. I guess there are some people that have.
Yeah, no, I think the big change is, right, the big change has been really in the last 5 years is that, the recommendation is that even from age 6 months and above, children should be vaccinated annually against influenza, which is a change because prior to that, it was the recommendation for starting vaccination was much later.
And also the inclusion of all adults instead of adults in high-risk groups
Right.
Has been over the last couple of years.
Have those recommendations been taken seriously among your clientele or among well, they're my consumers, they're your patients? I mean, are we outreaching enough? I mean, this show is important to get that message out. Thankfully, Kim, I think we do a great job doing that, but is it being heard? Is it being followed? I mean, what are the
I see a lot of complacency, particularly among young adults, that they're, invulnerable.
They live forever, don't they?
Well, young adults and up through, I'd say younger than age 50, I have a tough time convincing people. Yeah. I found that my biggest lever is to point out, ask if they can afford to be out of work for 5 days or not.
Sure.
Absolutely, and that's another thing too that I'd like to mention, that when people are not feeling well, please, please, please stay home.
Yes.
Stay home. We don't want influenza. Nobody does, or any of the other contagious diseases that we were talking about. So what are some of those high-risk groups that you mentioned, just so people can be a little bit more aware. Of course, the recommendation is that everybody gets the shot.
Sure. I mean, I think, you know, really it's certainly the folks that are likely to have complications if they were to get illness, we consider them always to be high risk. Pregnant women are especially high risk. We learned this was reemphasized from the pandemic in 2009. Folks with any other major comorbidity, any other chronic illness that may weaken their immune system, or just may be something they live with chronically, such as diabetes, heart failure, COPD, any history of lung disease, respiratory disease, they're at much higher risk. But really, it really is a recommendation for universal vaccination, which I think is an important point. I will mention there are some nuances, I think, with these new recommendations to vaccinate children greater than 6 months, and that is that when you do initiate vaccination in a young child under 8 years of age, if they haven't received the vaccine previously in prior years, that really the recommendation is that they receive 2 doses, which I think may be a cause for some confusion for some practitioners that aren't experts with vaccination. Of course, the CDC and FDA does a great job, putting out guidelines that are simple to use and interpret. But I think that's an important point as well.
And I'd just like to add to what Peter said, that there is also a population who are immune compromised, such as folks that have HIV or AIDS or cancers of sorts, and also healthcare workers. There are recommendations from infectious disease organizations such as SHEA and APIC, who strongly support immunization for all healthcare workers, along with CDC guidelines, which also encourage that.
There's actually some data that shows, at least in long-term care hospitals, that if all of the employees are immunized, that the mortality of hospitalization of patients is less. There's also some interesting data that influenza immunization can reduce heart attack by about 20%.
Really?
Yeah, that's how much this stresses your system.
Wow.
I
never heard that before.
2010.
That's a new fact. Yeah, that's a good thing. Yeah. Our development cycle, where we do geographic studies of all the flu viruses that are out there, and then prepare for when the virus moves north to this hemisphere. Is there an awareness factor? Does that work for you as far as, I know there are basically seven major companies, and they're global companies that work to produce the vaccine every year. So, I mean, a couple years ago, there were some problems, and as we remember, and the supply seemed somewhat limited, and that does cause a lot of talk about heart attacks. That does cause some degree of stress among the using public. The way the system is set up, have you folks found that it works as far as providing a vaccine, a dependable vaccine every year?
Since 2009, supply has been more than ample.
Right.
It's good to know. It's good to know. It's good to know. Yeah.
Right. It is. Problematic that it takes so long to develop a vaccine. For instance, in 2009, it wasn't I think the epidemic started in the spring. It wasn't until
in April.
Late fall
First
before the
cases were in
vaccine was
April.
available.
April it was, yeah.
Right, and there are 2 issues there. I know there's some work on cell culture system instead of egg-based. That's maybe more efficient, but we really need to develop new technologies. Not only do we need to develop more immunogenic vaccines, ones that are better and more efficient, and universal vaccines, but in the meantime, we need to work on faster production methods to ramp up so we can produce vaccine in a hurry in response to an epidemic.
Right, and this is actually a global issue. I actually was overseas during the pandemic in 2009 in Egypt, and a lot of countries don't even have access to influenza vaccination. So they were under much duress in terms of trying to mitigate this threat. It's important to know what's going on worldwide, and one other piece I'd like to say with influenza is, when folks travel overseas, people want to make sure their shots are up to date. If they're going to an area with malaria, they take pills to prevent that. But actually, influenza is really one of the top causes of illness in travelers when they travel overseas. So it's not just a problem within the United States. It's, we have to have awareness of what's going on globally, because different strains of flu, as Ed mentioned, come from various places, and things get exported to other countries. So it's important to know what's going on globally.
It's interesting, during the 1918 pandemic, which is kind of the the big landmark in influenza history. Much of the spread was caused by movement of troops.
That's correct.
You know, shiploads of troops being sent from the U.S. to other countries and carrying the illness with them.
Yeah, that's the landmark case that we use in public health and FDA. You look at the Spanish influenza, I think was a 1918 affair,
Right.
and you had soldiers coming back from France, and they brought it back where we're sitting right here now. We are not far from Fort Devens, I think, in Massachusetts, Air, Massachusetts, where that broke out. In fact, I believe there are probably soldiers still buried up there who were victims of that amazing influence. We lost 1 million Americans, and I think some 20 million people.
Over 20 million.
Yeah, it was an amazing affair, and it's something that we always wonder when it will reoccur.
Right.
Input on that. Can it well, you see people coming through all the time, and we're concerned. Can it happen again? I hope not. Will it happen again?
I think the infectious nature, how easy it is to communicate in influenza, was demonstrated in 2009. I think we were relatively spared in terms of the severity of illness, and a lot is still being researched in this regard. You know, 2009 quickly, the pandemic virus of 2009 quickly spread throughout the world, and it actually started in Mexico and the southern United States in April. So it actually arrived what we think is relatively late in what we typically think of as the flu season. But it rapidly spread throughout the world, and that gives us an example of, it was just like 1918, 1919 in some regards. I think the difference is we're spared in terms of modern medicine, and that the virus was probably less severe in terms of causing infection. But regardless, there were still many deaths and hospitalizations due to that. But I think it really is another lesson, a more recent lesson than what happened in 1918 and 1919.
Well,
And I think the one benefit too, Joe, that we do have that they did not have in 1918 and 1919 is we have much better communication systems.
Yes, exactly.
You know what I mean? And so we can spread a message quickly, and we can offer information in shows like this, so we can try to get people out and get the vaccination, whether they go to their local healthcare provider or their local pharmacy and get the vaccination, but also to messages like Karen's that don't cough into your hands, cough into your arm, don't touch your face, don't be spreading illness through shaking hands or things like that if you're not feeling well, but also all the time, and that's for all disease.
Peter mentioned social distancing, which is one of the criteria to prevent the spread of a pandemic in any type of influenza. And I imagine, and this is material for another show, there are strategic plans in place on a government level, a state level, and municipal level, and I'm sure up in your clinics to deal with that. And I'm glad that we're sophisticated enough to, as you said, Kim, to have that communications network in place. But third world nations, it's not the same.
Just social distancing. I see infected patients in my office all the time, and I'm in the habit of giving them a virtual, shake my hand, a virtual handshake like this.
Please don't touch me.
But people, they are immediately appreciative of that.
It's better just be like, hi.
Yeah. The other one to do is bump elbows.
Email them, right?
Yeah.
Yeah. It's an intriguing scenario, and it's so wonderful that Kim, we've made the time here to talk about it, and it's from where I sit in the bureaucracy, we don't see the clinical reality that you folks have, and it's eye-opening to understand that. It really is.
And I think here, also one of the key things that we focus on really is prevention, and with that outbreak back in 2009, really heightened the awareness in the community that, well, my flu shot is a valuable thing. And folks were, banging down the doors to get their flu shots, and then after a few years pass, now the complacency factor sets in once again, and we're trying to explain to people the importance of preventing by being prepared well ahead of a situation like that.
Absolutely. And I know in the media, we always know that at this time of year, it's important to do something on the flu. Is there anything else that any of you would like to add before we wrap up today's show?
Well, there is some evidence that you may have cumulative benefit from serial vaccinations. there seems to be some evidence that there may be some cross-reactivity and some at least limited protection, so that if you, let's say you get your vaccine every year and the flu strain that's circulating doesn't match the vaccine, if you get ill, you may not get as ill as you might otherwise. I think I'd also like to point out the efficacy of the vaccine. Peter mentioned that the typical vaccine is about 80% effective in preventing proven influenza. But interestingly, if you measure influenza-like illness, it's about 60% effective. So the message there is that, you know, there's a significant part of influenza, of flu-like illness, that's not caused by influenza. So if you get a flu shot one year and you get sick and comes, oh, I'm not going to get it because it didn't help me.
Oh, no.
That's not the whole story.
Yeah. You know, I would add just one thing, is really to encourage the public to get vaccinated and to really learn about sort of the safety of the vaccines, how much research has been involved in demonstrating this. And you know, certainly if folks want to learn more, they can go to flu.gov. It's a website set up by Health and Human Services specifically to address a lot of these issues. And they spell out a lot of what common misperceptions are and really debunk them. I mean, there's been a lot of very good research that has demonstrated the safety of vaccines. So I just encourage everybody who may be watching this show to really take a look at these resources that are available.
I'd just like to make a point about the side effects of vaccines. Again, come back to that. People with egg allergy, people tell me, you know, oh, I was allergic to eggs. And it turns out that maybe they had stomach problems when they were 5 or something. The current guidance is that unless you've had a true anaphylactic reaction with circulatory collapse to eggs, that it's safe for you to have the vaccine. The other question that people sometimes raise is that back in '76 there was an association between Guillain-Barré syndrome and influenza vaccine. That has not been observed in any year since then. The incidence seems to be about 1 in 1 million cases, which is about the same as that in the population who has not received flu vaccine. There's also some evidence that clinical influenza can precipitate Guillain-Barré syndrome. So really the only people who need to be worried about that, sort of as a common sense, not scientifically proven, we don't give flu vaccine to people who previously had Guillain-Barré syndrome.
Exactly.
But that's more out of a sense of prudence than any data.
Okay. Karen, anything you would like to add?
No, my big take-home message is it's good to be vaccinated. It's important to receive your flu vaccination on an annual basis and to do things like hand hygiene.
Yes, thank you so much, and thank you, all of you. Joe, another great show.
And thanks, Peter, for flu.gov.
Yes.
That's a good thing.
Exactly. Any last take-home messages that you would like to tell our audience at home, Joe?
Research, listen, do the hand washing, and I think we're a nation that's gifted with a lot of good knowledge, a lot of good technology. It's distributed, and this is just a great way to get it out. Thanks a lot.
Yes, and thank you, everybody at home, for watching our program today. We really appreciate your viewership. Once again, this is It's Your Health. Today we were focusing on the flu. My name is Kimberley Haas. Have a great day.